So I'm going to start with Jenny Cordina. And Jenny serves leading healthcare institutions on strategic healthcare issues with a focus on growth, consumer-driven impact, and performance transformation. She has over 20 years of experience, so she doesn't look like she can. How could she possibly have over 20 years of experience? Leading major performance and consumer transformations for both public and private healthcare organizations, which has resulted in improved financial performance, customer outcomes, and growth. Jenny is a recognized thought leader and author on the topics of healthcare consumerism and AI and generative AI enablement within the healthcare industry. Having designed and led McKinsey's Consumer Health Insights research since 2006, again, like almost 20 years, that's crazy. These insights and approaches enable healthcare organizations to better engage customers to improve business performance. Jenny has published numerous McKinsey articles addressing the challenges and opportunities of engaging consumers in the healthcare sector to deliver business performance and an improved consumer experience. She holds an MBA from Carnegie Mellon. She received her bachelor's in aerospace engineering, like this woman is amazing, and mechanics, and was a practicing engineer before she joined McKinsey. So like, I'm in awe of you. It's really hard to find like attractive, smart chicks in aerospace. And now look at everything she's done since then. I'm like, oh, I'm so happy to meet her. Travis, let me tell you a story about Travis. Travis and I have been friends for a couple years now. Travis Peterson, he is a most impressive individual. He's the Chief Commercial Officer at PontoSense, where he leads the commercialization and go-to-market strategy for cutting-edge technologies in elder care, automotive, and veterinary health. Let's just pause and think about that spectrum for a moment. Elder care, right? I'm over 60, so I know what that is. Automotive and veterinary health. It's like a very wide spectrum. With a background that includes leadership roles at Lear and a track record of revitalizing businesses and accelerating growth, Travis is known for his strategic vision and ability to build high-performing teams. He holds degrees in economics from OU and an MBA from Wayne State, and he continues to give back on a regular basis as an advisor and a mentor to future business leaders. Outside the boardroom, Travis is passionate about wildlife conservation and serves on the board of trustees for the Cheetah Conservation Fund, which is championing efforts to protect one of the world's most endangered species. He has 2 adorable children and an amazing wife. He is one lucky man, and we are all very lucky that he's here today. So, does anybody have any questions before we start? I know nothing about AI, right? It helps me when I'm searching on Google, but that's about it. So, do not direct any questions to me. But we have these 2 wonderful panelists, and we're going to talk about medical and AI together. So, let's start. And you can decide whoever is best suited to answer the question. You can each speak from your perspective, however you're most comfortable. Again, these are all generated from students. So how can AI most help or hinder the medical field?
So first off, just really great to be with you all. I hope this will be a wonderfully dialogue type session. It's always a lot more fun. Let me start by even saying what do we mean when we're talking about AI and how it can help in healthcare more broadly. So if I think about AI, it has been around for a very, very long time. It just used to be much simpler. So if you go back to the 70s, 80s, 90s, it was a lot of...
I'm sorry, can everyone hear her? Can you hear her in the back?
It's okay?
Yeah? Okay, because we do have a microphone.
Is this okay? Otherwise?
Mike.
Yeah, okay.
Use the mic.
Mike? Okay.
Just put this one.
Clearly not successful.
Test 1, 2.
All right. And so AI takes a number of different stages. And so when we talk about AI, just to kind of give you a thought of where it leads us today, is there's really 3 kind of core elements when people are talking about AI. The first is machine learning, ML. You've probably heard of that. What that is basically unstructured learning from the machine to identify patterns in data. So
So a lot of what's happening from an analytics standpoint when we talk about AI and when you're solving problems, you're actually using ML, part of AI, to basically say, help me understand in the data what I'm seeing, how to use it, how to find things. The second, where you get into like ChatGPT and all that wonderful stuff, is generative AI, Gen AI. And that is basically taking large language models and basically using that to synthesize key insights, to tailor communications with people. That's also where you get all of the interesting pictures and things like that. That's generative AI. And then the final piece is agentic. So that's where you're essentially the brain that would then basically orchestrate what you can do with AI. So an agent would be something that can basically look at the outputs of other parts of AI, like the ML model, or take that, generative AI communication that was generated and actually pull it together and do something. And there can be single model agents, which are doing a single task for a human, like an agent could help schedule things, for example. Or you can have multi-agents, so multiple agents working together. So you, for example, you could have an orchestration agent that's taking input from other agents to then act on it on the behalf of the other agents. So that's how you get, for example, like autonomous driving. So if we want to talk about like that, that's a great example that you guys are all probably familiar with. Say, how does that actually happen? Well, you have ML taking all the data. You don't really use Gen AI a whole lot. And then you've got a bunch of agents that are taking all of those inputs and basically doing different things with it. So when we talk about this question, where is AI most having impact? There's a lot of ways it's having impact, and it's using all three. And in many cases, you actually see things that are coming together across all three that actually drive the most impact. So if I give you one example from like the space I play in the most, on the consumer side of healthcare, for example, an example of how this might work is you say, I want to identify somebody who has a very high likelihood of having a readmission in a hospital. It's a very bad thing. That's when somebody goes into the hospital, let's say they get hip surgery, they come out, but they don't get their PT or they don't follow up their doctor, they end up getting an infection or they end up not doing what they're supposed to, so it ends up not working. They're back in the hospital 1 to 3 or 6 months later, and they have to get another surgery. That's readmission. So you can imagine it's very bad for the person, very expensive for the health system, bad all around. So how can you use AI just to bring it to life? Well, you can basically use ML to say, I'm going to actually figure out for that individual what their likelihood of having readmission is. And keep in mind what my likelihood is and Travis's is going to look very different. And it will literally use different factors. So in the old school type of AI, it might say, oh, if they're over 65, if they're male, if they're yada yada. It's like an if-then, and that's going to get you to who you want to target. But ML doesn't do it. It says, okay, for Jenny, we need to understand her attitude towards healthcare. We need to understand how likely she's been in the past to actually show up. We actually see that in her case, the fact that she's female does matter, but in the case of Travis, maybe it doesn't matter that he's male, so that factor doesn't get factored in. So you see what I mean? So everyone's getting literally a personal level assessment. So
Jenny, is this via like a questionnaire? What is the actual input?
great question. This happens behind the scenes from data.
Okay.
And so, for example, this said provider in this case might have 20, 30 data sets that are coming together to actually identify this. And that data would be everything from their medical record, which is their entire history of, what care they've gotten, all their demographics, those still actually are correlated to certain things, but it might also be contextual. Are they looking for things online? Are they sending their doctor messages via, the chat to get advice? Are they actually going on and scheduling stuff? So it's the contextual information too. So how often they're calling the call center, all these sorts of things. So you take all this data, and that's how you do it. And you might say, yeah, but what if you've never seen me before? How are you going to do it? Well, that's where digital twins, if you've heard that language, that's where digital twins come in. So you say, okay, maybe I don't have Jenny's data, but I have your data. And you know what? You look a lot like Jenny in many ways.
Thank God.
So I'm going to take your experience and apply it to Jenny. Now, once I get data about what she does, it's going to get smarter and it's going to change its opinion of me based on that. But until it gets that data, it's going to pull a digital twin or lookalike. So that's the wonderful thing about it is until you get more data, you can basically use things like digital twins to estimate those things.
Hit the ground running.
Hit the ground running. It's a great way to start. Then, okay, so I identified that Travis is very likely to come back, so I'm not going to worry about him. He's going to go to his doctor, he's going to get the care he needs. But Jenny, on the other hand, she is not good at following directions, and she is not good at necessarily coming back, so we're going to worry about her. So now, where does Jenny come in? So it's going to come in a couple different ways. The ML models aren't just going to tell me who to target, they're going to tell me how to target. So they're going to tell me what type of communication to Jenny actually is going to work. Do I have to be directive with her, like very forceful? Or do I need to be much softer and, help her feel good? Do I need that message to come from her doctor? Or would it come better from the nurse that she engages with? Is it going to be better if I call her on the phone? Or is it going to be better if I text and send her an email follow-up? So on and so forth. So you have who model, you then have how models. Now, here's where Gen AI comes in. It says, okay, great, you gave me all this information. Now I'm actually going to basically put together what that email is. Let's say Jenny needs email. So it's going to actually use all that information, and it's going to craft a message. And it's actually going to say, okay, this is the message that needs to be sent. Now here's where agentic comes in. Agentic basically allows us to do this without having a human involved. In the past, even with ML and generative AI, you still need a human to actually make sure that message gets sent. With agentic now, you have an agent who's managing all this and basically says, okay, great, I can now send that message to Jenny, I'll see what happens, and if she doesn't respond in the next X number of days, I'm going to follow up maybe without an email, then I'm going to actually text her. If that text doesn't work, the next thing is to make sure I'm giving her a call. And it's actually going to be able to do all of that without human intervention. So it's what makes personalization actually possible. Because you might have said at the beginning of this, okay, that all sounds great, but how do you actually activate that at scale when you've got millions of patients, right? You can't possibly do that. But thanks to the combination of these three things, what would have been absolutely impossible a decade to do, you can do it. So that's an example that's very visceral. But the exciting thing is it's also helping on things that you would not necessarily see. So for example, how many of you have had to get a prior auth? Raise your hand if you've had to get a prior auth. Definitely seeing age coming into play on this one. But I can guess who had a good experience with prior auth. That's good. I'm glad to hear that. A lot of the other hands that went up did not go up again. And the reason why is it's generally speaking, it can be quite challenging to have that happen in a very timely way. Sometimes you'll get it, but it isn't quick enough to get the surgery or the follow-up care you need. Sometimes you'll get it, but they basically say you have to go somewhere else. Yada, yada. There's all sorts of things. What all of these technologies, for example, can come together to do is they can actually also talk to themselves. So payers or health insurers can talk to the agents of the providers or health systems. And now you've got agents who can actually talk to each other and basically sort it all out immediately. After hours, 24 hours a day, 7 days a week, without having a human involved. And more often than not, actually resolve the issues without having to get on a phone, wait for 30 minutes to talk to a human being, so on and so forth. So the question, where can healthcare, if I go back, is a very, very long-winded way to get to this. It can help in just about anything. So it helps from making it easier to getting recommendations about what care you might need to what the right health plan for you is. It's going to make things better in terms of you can now talk to agents on the phone who are actually not like what you were talking to 10 years ago, but who are actually fully able to solve your problems. And by the way, also take out a lot of these healthcare costs that make the premiums go up. They're going to be able to enable clinicians to be able to respond to your needs much more quickly. It's going to be able to document things that would have taken so long. On the pharmaceutical side, it's going to help identify new drug opportunities. It's going to help improve clinical trials. So at every part of the healthcare, it's going to enable it.
So question, Jenny, we've all kind of heard the phrase garbage in, garbage out, right?
Yes.
How is the system protecting itself from bringing garbage in, because then it would also be sending garbage out?
Yeah, that's a great question. So one, as you can imagine, in healthcare, the data that is coming in, one, there's very high bar on it for most healthcare organizations, and the health records in particular are quite good. I think where you end up having on the back end, I don't know how much time you guys all spend on this, but you do have to clean the data that I was talking about. So there's data and feature engineering. I'm not sure how much. Basically what that is so as I was mentioning, there are like, let's say 20, 30, 40 data sets. Out of that, you might have, you know, for any given use case, maybe 250 features. In many cases, you're getting up to over 1,000 features, where you actually coded the data to basically say, what does that data mean? So to the point, I might not care at some nuanced level of some piece of data, but what I really care is some combination thereof.
And is it consistent?
And is it consistent? Is
Okay.
it timely? All
Okay.
those sorts of things. And so that's where all that data cleaning and the feature engineering and all that has to happen to get the data to a place where you can do any of what I was talking about. But I will say, and you didn't ask this directly, but I'll add it too, is there also has to be a lot of risk mitigation. So the nice thing within Gen AI and with ML is you do have to put safeguards in place. So for example, a big thing in healthcare people get worried about, and rightly so, is like bias testing. So for example, are we accounting for biases that might exist within the data just because certain people go in for certain things and other people might not go in for certain things, but they might both have the same need? Because you don't want to make, end up giving inappropriate focus on certain populations that, the data. Or similarly, in that Gen AI was mentioning, you actually have to have it go through a risk protocol to check itself to make sure it's not giving clinical advice, okay? We don't want that happening. We have to check for is it actually saying things we don't want it to say, right? And so you can actually, within the code, have it check itself. And having those safeguards is incredibly important, and every company I've seen has different rules that they put in place and different checks they put in place, but they most definitely have to be there. Otherwise, it's going to hurt people's trust quite significantly in AI. And even now, in a lot of the research I lead, we see that even between 2024 and 2025, we actually saw a dip in people's trust of sharing their health data, which is counterintuitive because it had been going up for so long. Whether or not, I don't know how much you pay attention to the news in healthcare, but there were a couple of pretty big data breaches at the end of last year. And it killed trust, just absolutely killed trust. People said, I'm not sure I trust this anymore when my PHI is getting out there, right? And so we saw that actually come down by 12 percentage points. That's huge. So I think to your point, this notion of making sure that it is good data, we're using it in the right way, and that we're protecting it is critically important. Otherwise, consumers aren't going to trust what's happening.
Excellent. Great explanation. How are you going to follow that, Travis?
You did a good job on the 101 for me, thank you. Better than I would do. No, I'll get a little more specific in a few ways because the garbage in, garbage out is a really critical piece because your AIs and your algorithms are only as good as what you train them on, right? So if you train them on garbage, they're not going to be worth anything. And that's something in our space, so like what our company does is we create devices that feed a lot of this data into the insurance carriers, for example. So we'll work with like United Health, and we will actually feed in those vitals data, the patient data, on an ambient basis, maybe in-home care, for example, is a big business where you have people aging at home, and a lot of elderly people don't communicate well with their physicians, with their caregivers, with their family, whether they have dementia or what's a big thing is the risk of loss of independence. So they just don't communicate these things. So there's a lot of devices and technologies that are coming out to say, okay, if I want to actually get these benefits and feed into these AI models at the top, there's all these steps between that have to be bridged. And that's become a big issue we see in our competitive space and in a lot of the clients we work with, whether it's on the hospital groups, agencies, insurance, is sifting through how to get that level of data integrity. And then privacy is another big piece because now you've started to see people say, okay, we need all this data. It can be very invasive to collect the data. So people are actually trying to use things like audio now or cameras. Well, if you think of a medical instance or a home, a long-term care home, all these facilities, rehab facilities, it's really not an attractive proposition to put things like cameras and audio into bedrooms, into bathrooms to collect patient data when they're not in the office, right? When they're not coming in to do these things, when they're not at the hospital. These are areas where your privacy is very critical. And that's become another challenge with how to get the data to these places like Jenny was describing in a way that is still suitable for the consumer, for people that gain that trust, because I think that's another big piece we see a lot with the advent of AI is this impression that it's breaking that privacy, breaking that trust of people. So we get into a lot of discussions around anonymizing data in different ways and training these models to exactly what Jenny was saying, so that when we look at the digital twins and things, we have meaningful data there, but at its core, it's still very private and it's still bringing that benefit to the consumers.
Excellent, thank you. So maybe I'll direct this one to you, Travis. What might be some blind spots in AI when applied to healthcare?
One of the bigger blind spots I see right now is a lot of people not understanding what AI is. We see a lot of companies, products, services, software, whatever it is, talking about, I've got an AI solution that does this. But if you actually sit down and look at it, there's a lot of companies doing this, they're running data through ChatGPT. And that's not an AI that's doing a job, right? You're leveraging an AI tool like you would Excel. But that's been, I think, one of the biggest blind spots right now is there's this excitement around AI because it is very impactful, it's very on trend for the world in a lot of ways. And the healthcare industry is in such desperate need of bridging the issues with like labor shortages, not just in the US, but globally, as well as this desire to bring costs down to find these efficiencies that AI brings. That I think one of the biggest blind spots is this adoption of technology without really understanding what's in the periphery and really doing your due diligence on the technology. And that's, we personally, on my side, we get a lot of those calls and involved in a lot of companies and areas where we'll jump in midstream because they started deploying a technology and they find out that it's not what was packaged, it's not actually private. I won't name the company, there's a company doing the audio I was talking about that is in our space. And we're talking about how it's all anonymous, it's anonymized, the AI is doing the interpretation, your personal data is not shared. And a month ago at a conference, they shared the data on stage in front of people and everyone said, well, I thought you said it wasn't recorded. And they were kind of like deers in headlights. And that's part of the problem, I think, is you're gonna have a lot of these companies and players come out of left field and the health providers have to really do a very, very good job of doing due diligence to avoid the negative side of that, where we get into these data and privacy issues that can cause a lot of concerns, and that can set back that adoption for months, years even, of certain technology that otherwise should be beneficial.
I love that, and maybe just to build on what you said, maybe one other, I think, blind spot, less about the data or anything, but is just how hard it is to embed and scale this stuff. I think to the point, a lot of folks think it's a bit of a panacea, and similar to what you're saying, I'm seeing the same thing. Part of the reason I gave you the 101, it wasn't to be pedantic, it was because everyone's like, oh, now I want agentic, for example. Initially it was all about ML, then for the past couple of years it's been all about Gen AI, now I want agentic. It's like, it's not like you skip the others, right? And I think there is a bit of a blind spot in saying, how do I actually build this like a capability, like anything else, to enable an organization? It's not about getting all these fancy tools, that's part of it. But it's how are you creating the infrastructure that can actually have technology enabling what you're doing? And then how do you scale it? Which is more about the operating model within the company. It's more about the change management. It's more about, you're not going to go just hire all these people. You have to get your workforce to learn how to adopt these things, to create them, to use them. And that's entirely new and different. And so I think there's a lot of focus on the tools and not a lot of focus on the how you actually change an organization and enable them to actually leverage all these tools.
And with that being said, you've provided the perfect transition to, is AI replacing workers in healthcare?
I mean, I think I'd be insincere if I said no. I do think ultimately, part of the benefit of AI is it should make, one, enable things we couldn't do before, like in that personalization. You just couldn't do it before, right? So now you're actually doing something you never were doing before. But there are cases like in the prior auth example I gave, hopefully that's going to get rid of thousands of those jobs, right? Companies are spending every single company, healthcare company is spending millions of dollars on prior authorization. Why? I'm not sure any of us want our money that's going to pay for healthcare going to pay for that. So I understand there's going to be jobs lost in certain places, but I would think most of us want our healthcare costs to go down and don't particularly want to pay for some of these things that frankly don't have a value add. And hopefully that frees up people to go do more exciting things. I'm not sure people doing, claims processing or prior auth those aren't the most exciting jobs in the world either. So hopefully what it's going to do is just like it did here in Detroit, right, where we said, how do we make production more efficient, right? It's not like people wanted to keep using the horse-drawn carriage. No, we're going to go get cars. I feel like this is that same thing. It's uncomfortable, but it's just part of, I think, advancement of our civilization.
And that's, so where we're at, the space we're in is a lot of what we rely on is actually filling the gaps of humans. And in some ways, I'll give you guys an example. A few months ago, we rolled out an LLM, a large language model, that is taking certain data collected either like in long-term care nursing homes or even in-home applications. And on a weekly basis, we have an agentic AI that will then report out to the families and make communication on trends that are changing in their behaviors and health, and these give the insights into predictive analytics, which saves money. And a big area where that brought value to caregivers was, at the end of the week, a lot of these agencies and these firms have someone sitting at a desk, sifting through data, notes, and they're putting a report together and sending it out, when they could be doing 20 other things. And that's where the answer is probably yes, like you said, Jenny, is you're going to replace certain elements of it, but you're going to unlock capacity elsewhere. And that's been something we've seen readily through the year that's been really interesting, is when you look at a lot of these firms that are deploying the tools in the right way, you'll actually see patient satisfaction go up, because now instead of having somebody that's spending 8 hours on a Friday putting all that together, they're spending more time with the residents, with the patients, and the people are immediately saying, I don't know what changed, but I feel like there's people more present, we feel more watched over, we feel safer in these environments and all these other things. And that translates to these other health benefits that we can actually correlate savings to, particularly with elderly people, because loneliness and that feeling of alone is actually equivalent to, for an elderly person, smoking a pack of cigarettes a day from a health perspective. So there's a lot of avenues we look at it, and I think the people that hone in on like, hey, this is gonna get rid of that area, are kind of not looking at the macro picture. And if you go broader than the US, I know we're talking a lot about the US, but other parts of the world, if you go look in like Southeast Asia, Japan, in a lot of these care facilities and these types of hospital environments, they're often, like in Japan, there's generally around 60 residents and patients for every 2 caregivers that are watching over them. And that's a major societal issue that you can't fill the gap with a population that in 5 years is going to be 40% over the age of 62. So you have to fill it with technology. And that's where I think you're going to see this race around the world of who's going to actually adopt the technologies. Because there's a lot of conversation about how to make the technology, but the question is actually who's going to adopt it, leverage it, and that's going to unlock a lot of capacity for the next 5, 10, 20 years that has all these ancillary benefits down the road.
Awesome. So can AI today be used to help diagnose patients with illnesses, or how could it potentially have early detection for disease?
Yes, I can take this first, but so again, just to give some context, a lot of our technology that I'm talking about is we create ambient sensors that go in a corner of a room, for example, and we can detect vitals, movement, things like that. There's a lot of technologies that do different elements of that, but where you get into prediction with AI is, a good example is detecting dementia. So there are indicators of dementia, for example, changes in your gait. So the way you walk, there can be subtle changes over time that eventually indicate and translate into dementia. We're using things like radar at a room level to monitor and detect those over time and have an AI that is looking at that and flagging it. We see the same thing with things like AFib, with sleep apnea, where you can do ambient monitoring of breathing and sleep. And these AIs are able to detect such subtle week over week, month over month changes that they can flag. And what's important though, I think, is the caution is not to diagnose though. Is because that's something that you get into a huge liability issue, number one, but number two, are we there yet technically? And based on some of what I can tell you our AI has spit out, I would tell you no. And that's where it gets into the ability to leverage and make it, like a physician, for example, more efficient. Because now we can give them a platter of data that has already been sifted, oriented, and we flag the anomalies. Because that's oftentimes what you're actually looking for in these areas, is what's changing from a baseline, whether it's vital signs, whether it's walk, all these other areas of data, is you're honing in on where these areas are. I don't know, I forget the company, but like 2 weeks ago, there's an FDA approval going through for breast cancer, where they're using AI for early detection, and they're showing that you can actually detect it 2 years in advance of modern technology. So that's a perfect example where you're able to see these subtle changes, but again, it's not a diagnosis, it's a detection that flags it to a human physician that then makes that diagnosis.
Okay, so let me just jump in real quick then, because another student asked, how will reliance on AI affect doctors' abilities to detect diseases and issues? Similar to the question of,
You know, if I have a calculator all the time, doesn't that diminish my math skills, like my ability to do math in my head quickly? So what do you anticipate, how do you anticipate that that could affect a doctor if he constantly has all of this great information? Is he gonna basically get lazy, right? Or what do you think? What do you think could be the outcome moving forward from a physician's perspective?
Yeah, so from our view, I think we've seen a lot of people we talk to, they equate it to Excel. That's the most common comparison I hear is, and that's how most, I think, physicians, because physicians and people in those types of fields, I think, are typically, number one, generally pretty interested in what they do. And a lot of that is around the research and the medical component. So I think to pull someone out and think that you're going to create laziness over a tool would be maybe the exception, but definitely not the rule. But I think what we've seen is a lot of a desire for that data. It's really another way of getting data and doing it in a streamlined, efficient manner so that the doctor doesn't feel his time is wasted. My dad's actually a doctor, and he's the first person to say, I hate going through my notes with my staff, I get all these pieces, it takes all this time, and now he's using tools where he can aggregate it all immediately, and he's 10 times more efficient, and he loves it. And he actually is cramming in more work, I think, than he otherwise would have. So it's actually done the inverse, from my perspective.
I'll take both of those and just add to it, because I 100% agree with everything you said. I think on the first one, I just want to give you two other examples on how you can use it to, I don't think any of us is ready to identify and tell you clinically what to do. I think that's a very, right now, a do not cross sort of thing for most companies that I'm aware of anyway. But what it does do is it can really help, for example, with access, for example. Right now, I don't know, the last time we all tried to get healthcare, but it can take a lot of time. It's not always that easy to get in. Well, a lot of that is because, kind of what you said, people go into the wrong channel, they see the wrong doctor, it was a waste of that doctor's time, it was the wrong place to go. They go into an ED when they frankly didn't have to go in at all, probably. All sorts of that stuff. If you can actually have AI that can help navigate, it can actually get people to virtual care, urgent care, their PCP, ED, whatever the right solution is, much more efficiently. And so you can train AI to help with things like that, for example, that actually free up a lot of capacity in the system. Similarly, it can help people actually get done well, and if they're using the right data, can help them actually take better proactive care of themselves between those visits. So I would say I think there's ways it can be used to the point, I don't think any of us think that it should be actually solved in clinical need yet. And 100% agree. I think what I've seen is, for example, just to give you another two additional examples, like, I'm not sure if there's any doctors in the room, but they spend so much time with the EHR inputting, you know, their notes from visits and responding to patients and all this stuff, and to the point then they're not actually with the patient, right? AI and ambient listening and all this stuff, it's one of the first places everyone's going to is clinical productivity, is what we call it. Because clinical productivity can be massively improved, to the point Travis is making, and that allows doctors to actually spend more time with their patients and understand their needs to give them better care, not the opposite. And to your point, you struck something on the timing. This was several years ago. We were looking at like payer claims data. You can identify people about 2 years in advance and having inpatient mental health issues with upper 90% accuracy off the data. You can identify the likelihood if people are going to basically do all the stuff I was mentioning at the beginning. AI is incredibly good at flagging people and what's likely to happen so that doctors can actually be more proactive and address these needs in advance so that people are actually getting much better health outcomes. And so I do think this is a little bit of, and even with physicians, nobody looks at how often physicians are wrong, right?
We call it practicing medicine, right?
And a lot of times it's not their fault, right? Somebody, you know, imagine you go to the doctor, they told you to take some whatever, it didn't work, you end up seeing a different doctor because they weren't available. They don't know that it didn't work, right? They don't necessarily see the outcome of what happened from their advice in many cases. So that feedback loop is massively missing in the healthcare system. It's kind of crazy when you think about it. If this was an engineering company, you'd never allow that to happen. Like something breaks, you figure out why it broke, and you fix it, right? And you make sure it doesn't happen again. That doesn't actually happen in medicine. That feedback loop very seldom happens, right? And it is a big black box. The nice thing is with AI, it's actually identifying a lot of this stuff in advance to actually enable the clinicians, whereas in the past they might not have known. So less than being lazy, now you get the wisdom of all the different care from the actual claims data, see, oh, actually, I'll give you a real example. I was talking with a lab company, and there are so many lab tests, literally hundreds of them. If you're a doctor, you don't know every single lab test or what the right test is for everything. So now what they're doing with AI is based on that patient data, what they're saying, they're actually recommending to the physician what the right lab test is. Now the physician can figure out what they think then the right one is or completely override it. But the point is they're being given input to make a better decision. What that doctor, it's kind of like in a cockpit, right? There is autopilot, but you still have the pilot there. It's the same thing. They're gonna help make it safer, right? But they're not gonna take over.
Well, it's always easier and you utilize less resources when you edit versus author,
Yes.
right? And so if it's giving you that and then you just determine what's the most preferential path, much better.
Yeah, and it's funny, beyond the clinical, like in the lab case I was giving you, they're also then saying the likelihood it'll be covered for the person based on what they know of that person's coverage. Because the last thing you want is then that patient goes and gets that lab test and it wasn't covered and they're now stuck with a bill when there might have been another perfectly good test that was actually covered. And so in many cases, when it has that information, it's even including that type of information, right? So you're actually getting to a better outcome in every way.
Fabulous if my insurance can tell me what it meant to me.
Right.
Because nobody's gonna sit there and read through all that font to
No.
print.
And
They're
your
just
point,
not.
in this case, it's not even like you would ever even know, because the doctor sees it. Oh, okay, based on your insurance, this is probably the best lab test for you. You can go get it, and now you're not gonna get the bill at the end, and you'll be like, but I thought this was covered, right? So it is funny how these things, and hopefully a lot of this you'll never even see, right? It's happening behind the scenes, making your life better.
So we talked a little bit about bias in data. This question asks, does the industry see a risk to AI creating biases in decision-making by taking out the human element? For example, transplant decisions are made through human discussion and logic. Is it more likely that these types of processes will be bolstered with AI as a tool versus an AI replacing humans at different points in the decision-making chain?
So I think, I think in line with what we were just saying, I don't think it takes away, right? I think what we're saying is AI should hopefully help clinicians make better decisions. On the transplant case, there already are rules, right? There is a transplant committee, whatever, that decides who gets the next one. That already is happening, right? So what I would say is hopefully what AI will do is help make better decisions because it actually has more data, more information, and hopefully will lead to people making better decisions. But I don't think in any of these cases that we're talking about AI isn't making a decision, right? What it's doing is giving you information from which to make a decision. So.
But do you think it could create its own biases?
Sure, and that's where I think all these bias checks come in. And so you absolutely, companies have to have these in place, otherwise they do risk that. And we see it time and again in populations, especially different types of populations will, have different needs, will have need to solve things in different ways. And so if you don't have those things in place, yeah, you could get to faulty outcomes. I mean, I see this all the time, like with, you guys have heard about correlation causation, right? They are very different. And the problem a lot of times is even in these ML models, you end up getting correlations more than causations. So let me give you a real example. Like, I led all of our research into COVID through that period in terms of who's getting vaccines and not. And one of my biggest frustrations, honestly, had a lot to do with race coming into play. When you actually normalized for race and looked at other factors, they were much, much more indicative of what a person was going to do. And yet time and again, it was made up as though it was a racial issue. It just wasn't. It had way more to do with a person's education, income level, and things like that when you normalize for race. And so you're solving for the wrong problem, right? Because back to this point, the likelihood of somebody going and getting it and why they weren't getting it, you were addressing the wrong issues, just fundamentally. And so I think to your point, I even in my own work get frustrated when people look at data and they're not normalizing it in the right way, they're not looking at it in the right way. And this happens in many ways. For example, if you look at a 30-year-old that's highly chronic, you look at a 60-year-old that's highly chronic, they behave incredibly similarly. Because in a clinical setting, those chronic conditions are much more indicative of what someone's going to do than their age. Yet, they'll be like, oh, well, seniors are more likely, yada, yada, yada. Sure, because on average, they have way more of these clinical conditions. It's actually not a useful comparison. So what I would say is we already are doing all these biases, frankly, today. Hopefully, AI will actually make us better because you can actually put those checks in place. Right now, what I see is a lot of really bad research out there, frankly.
Travis, what kind of bias checks do you put in place?
Yeah, so one thing we see a lot is you need to accept that the work is never done, your training's never done, the model's never perfect. I think that's a key piece. So we talked a lot about like ML, and ML is kind of like, in my opinion, the real foundational piece. If you have bad algorithms and you're not trained properly, nothing else in the chain is gonna work. But what we do from a bias perspective is we do a lot of training that's constant, and what we really enjoy is finding what we call edge cases, and we see that a lot coming into more question on automotive, for example. So obviously, most of the presence around here is oftentimes tied to automotive. And about 2 years ago, some regulations came out. And so, okay, here's what you guys have to do from a compliance perspective, mostly in Europe around safety, some sensing, some in-cabin technologies, detecting humans. And there was some training went on, a bunch of the big firms created these models, and they said, okay, great, we've created these systems and solutions that can do X, Y, and Z. But where that created the blind spot goes kind of into where you started biasing it towards these models and these populations that you were training it on. And what people failed to understand, I think, at an early point, which is a little surprising because a lot of these companies are multi-billion-dollar companies, was that the population sets have to be so massive that you're never really stopping to train. So, from a bias perspective, the way we always approach it is that there's always going to be that outlier, there's always going to be this ability to continue training, and that's where we actually are now even using AI to try to find those areas of where are the areas that are these outliers, these other extreme cases that we're not thinking of, that we're not watching. And we've seen a lot of that. I mean, a great example of one is they were trying to detect vital signs in vehicles for in-cabin safety. And there's a very large German company that their head of radar figured out. He took one of those Chinese cats you see at a Chinese restaurant with the hand that moves, and he put it on the instrument panel, and almost every device that it was being marketed as production ready immediately said there's a human in the car because it was mimicking the respiratory rate of a human. So those are areas where no one's test method would have said put a Chinese restaurant cat on and test it, right? But those are where I think we have to also be pragmatic about, again, to what level are you training these models and how are you going to continue to train them? Because when people say, hey, we have a product, here it is, and it's not updating, you're already behind them at that point, and you're allowing those biases to creep in and the continuous improvement to kind of stop.
Excellent. So we have a couple more questions. I also want to leave enough time for you guys, so start thinking about questions that you might have right now. I'm going to go off this question, and I'm just going to ask a question for me. What do you guys think is the most interesting thing in your work that could come to fruition during our lifetime? Like, my lifetime's shorter than a 20-year-old student, but within the realm, what do you think realistically, based on AI, could come to fruition in, say, the next 20, 30 years?
So for our world, where we're focused more on combining hardware with the AI and the software piece, I think what's really interesting is 3, 4, 5 years ago, in our world of ambient sensing, the hardware wasn't there to give the AI the data it needed. So that was step number one. But now we've had technology make leaps in the past, really 3 years, where we can get the data to a granular level that is able to be interpreted and appropriately put in these models at a level that you can rely on. I think in the next 20 to 30 years, what you're going to see is a huge jump, not just in the AI piece and what you're learning there, because if you think over time and time, these models are going to get smarter and smarter just as they continue training and absorbing data, but the inputs to them is going to be vastly more improved, even if you just look at the past 3 years. Right now you can measure people's heart rate 20, 30 feet away, for example, with $40, $50, $60 sensors. Think in 30 years what you're going to be able to do, because 3 years you couldn't do that. So now you're going to get to the point of where telehealth starts to get very, very relevant. I think in a month, if you guys pay attention at all to like Cisco and companies, you're going to see a pretty exciting announcement in Toronto come out from Cisco on telehealth, where they're starting to leverage these AI models and this combination though of hardware in the real world with the software piece. And I think for me, that's where I think the biggest jump is not just going to be that AI is going to be so much better, if you will, and you're going to have this agentic system where you're going to have all the tiered structures like Jenny was describing, but you're going to have the capability to deploy very inexpensive hardware in lots of different ways and settings, whether it's security, health, automotive, you name it. that's gonna make the AI wildly more impactful, and oftentimes we're probably not even gonna realize it's happening. And that's where I think it's gonna be really interesting to see where that combination of hardware and software come into play, because there's a lot of fascinating technology coming that's gonna enable the AIs to get so much more data, so much more cleanly. It's gonna be really interesting.
I love what you said. I'm struggling, even though I had time to think about the question. I started doing consumerism in healthcare 20 years ago. And so,
Look how much has changed.
how much has changed, but how much hasn't.
Okay.
And if I think about this, you know, how much easier is it to get care today than it was 20 years ago? I think it's actually harder. So I don't know. I want to be really optimistic, and I would like to think that AI is going to fundamentally change healthcare. I'm really hoping. I know it has the capability of doing it. I think, to maybe one of the earlier comments, how quickly organizations are able to take it and really scale it, I think is going to be whether or not it does truly change. I think the thing that might be different is it's much more competitive now than it was 20 years ago. The tech companies, I don't know, all of the hundreds of health startups are fun. I mean, they're so amazing, some of them. And so if they are able to scale, and the amount of PE money and VC money that's coming in, I hope that they can truly transform it. I hope that, you know, when I was giving you the personalization example, I really hope that happens in the next 20 years, truly, like, for every single human being.
So if we reel it in and maybe we say 5 years, maybe if we look back, if you look back at what you've learned, research in the last 5 years, I mean, what do you predict for the next 5 based on historical of what you've actually experienced?
Yeah. I definitely do think one of the biggest places is gonna make a huge difference for the consumer is around this notion of access, navigation, and personalization of information. That's happening. Consumers are engaging in AI. About 1 in 5 are engaging with healthcare chatbots and things like that already. So I do, to the point at the speed at which it's happening, I really do think in 5 years that's gonna be happening in a very meaningful way. What I don't know is how much it'll fundamentally change affordability. Some of those bigger macro questions, that's what I don't yet know. But I do think, to your point, I see that changing pretty quickly.
Okay. I'm gonna turn it over to you guys. Does anybody have, and somebody better, have a question for our esteemed panelists tonight? Yes. I'm gonna chat GPT.
So you guys mentioned regulating AI with patient data. What are some like the governance challenges with using patient data on those machine learning models? Because they need to like work with actual data, but you have to prioritize privacy.
So I'll start and then think about if I take the most basic, which is the claim system, or the EHR for a provider, claims for a payer, that data is all usable. So to your point, you can train the model on that, with all the operational data, all the stuff that I was talking about at the beginning, all of that you can train on. Where you have to really think about HIPAA and PHI is you do need consent for how you use that at an individual level. So what these healthcare companies can do is they can train, they can learn, because they basically anonymize the data record, right? So you strip out all the PHI basically, and you can then use everything else. So there are very clear guidelines on how you can use data in healthcare. And so once you do that, all of our data can be used in that way by health systems. But whether or not you can actually then take it to that next level, then it depends a lot on the rules in terms of, is it for medical care, is it for, there's different rules depending on what the data is being used for. So for example, there's very different requirements around how you use data for like marketing than how you use it for someone's care delivery. They're very, very different. And so what I'd say is it's a very nuanced thing, and so every company has to really be thoughtful about how they're training and using the data, and then how it's being leveraged at the human level, which is very use case specific, very different. But yeah, it's a good question.
Thank you.
Yeah, I think the other thing to think about is where's the data coming from, right? Because there are these chains, like Jenny's talking about EHRs, which are, where a lot of the data is actually being pulled from, but particularly for the physicians. But there are links that are feeding into EHRs, and there could be links that feed into that system and so on. And that's where I think we've seen a lot, particularly overseas companies, bringing solutions from places like Israel, China, wherever. China's a little less receptive in the US right now, obviously, but that's where there's also this focus and reluctance from companies even to own the liability, because there is this kind of black box, I think, happening where people are pulling data and you don't actually know where it's necessarily being trained from. There's been a lot of the media where you've seen people, there was a big lawsuit, I think it was Amazon's books that were being used without a license to train, things like that. So that's part of it too, is that you don't necessarily know where the data is coming from. But we are seeing, especially, I would say, this year in particular, we've seen a huge emphasis on validating things like HIPAA compliance, SOC 2. There's a lot of other compliance in Canada and around the world, where it's going deeper down the supply chain. Where now if you sell a device that hooks up to a system that interprets it and then feeds data to an EHR, they're going down that deep to verify that you actually are HIPAA compliant, that you're meeting these compliance records. And we've seen some companies even have to pivot their technology. I mentioned cameras earlier. Cameras are obviously not private, so one of the ways they're doing that is they're anonymizing visuals to basically where the output of a camera shows it as a stick figure. There's still some question and debate over if that's truly anonymized and private or not, but you're going to see also solutions like that too happen, I think, where we're going to find where is that line and what is the actual interpretation of privacy when we apply this data to be interpreted and feed into these models as well.
Excellent. Does anyone else? Yes?
Do you anticipate an increase in malpractice lawsuits based on whether or not a physician did use AI or did not use AI?
It's hard to know, not my area of specialty, but I think one thing I can tell you I have seen is in a lot of legal conversations and even in simple sales agreements between a lot of these companies and firms, I think there's a huge question right now on who owns the liability of where the data is coming from and how it's being interpreted. So I think there's a risk across the board of, at some point, all of that coming to a head because no one wants to own the liability. We get into, in our area where we're doing more physical monitoring, the big discussion is always, what if someone dies? Well, we're also not making certain medical claims, so there's all these ways you get around it. But at some point, those types of things do get to a head. So, I mean, I think they're gonna have to figure out a better way probably to regulate it and to qualify those things. Because I don't know if people actually understand what the implication of what you're asking actually means, because it's so early on applying these types of technologies to make a decision.
I don't think I have anything to add, definitely not my area of expertise, but I think that's why we were talking about the bright line of clinical, that's why.
Yes?
Two related questions. First is, you're asking physicians' willingness to use deep learning computer vision models as part of their practice, and healthcare organizations, their willingness to use fine-tuning or customization of large language models to improve their business.
Yeah, so from our side, we see the LLMs be the easiest because there's also the scale of what is an LLM. That's where I mentioned earlier, like, some people are just running data through a ChatGPT, and you do see a lot of that. And it can be meaningful even in some ways, right? There are areas of the industry where all you need is a simple kind of summary in a way. But I think that's where we've seen, particularly on like preventative care and things like that, where the LLM models in particular are very, very, very meaningful because it is difficult to trend, or even if you show someone a graph, I can trend the same data, put it in a graph, but a human still has to sit there and interpret it. And if you just take that simple step away and deliver it in a more concise way that's already flagged and quantified some of those deviations and things, I think that's a much easier grab as well, where the doctors, physicians, the providers are all more willing to accept that as a tool too. Because I think you do still see skepticism too. There are particularly, so we operate in veterinary care. I mean, it's a wildly different business from healthcare, but it's similar in the sense that there are a lot of older individuals in the industry, and there is this kind of inherent resistance to new technology, especially when you're trying to apply it in a way that has these life or death implications in some ways.
The only thing, I know it's not directly what you asked, but I will say, beyond the clinician though, this is where the GenAI, the LLMs feed. this is where a lot of the back office stuff can really, you can take a lot of efficiency improvements. And so, you know, everything from, if you think about like Medicaid contracting for that, think about it, every state has their procurement process, right? You can through an LLM now actually mine all of that and understand what's happening. Like there's so many of these types of applications that you wouldn't naturally think about because they're back office sort of stuff, but huge potential to just massively, not just streamline, but improve the quality of the output because of just the sheer complexity and amount of information that's out there. So, but I'd say is beyond the just clinical facing, which is obviously a huge opportunity, there's a ton of back office stuff with this that's incredibly meaningful.
In the back.
I was wondering, have you seen any advancements in AI in regards to like surgery, anything like with certain machines or, you know, I guess like helping locate an artery? I'm not a physician, but.
Definitely not my own expertise, probably more yours, but I will say things like obviously like robotics and stuff is definitely emerging. I will tell you just the one funny thing, given you asked the question is one of the things we asked consumers in May, we had a big annual survey, and we asked them about uses of AI, and so we actually did ask about like AI-enabled robotic surgery interest and that sort of thing. And interestingly, about 20% of consumers said they're open to it. So less about whether or not it's ready for that, but more about just the fact that consumers, it's amazing. The interest in many of these solutions is actually, to me, when you're saying from, you know, these things didn't even exist 5 years ago, right? And the fact that that many people are already open to some of these things, that's pretty stunning. I've never seen consumer sentiment change this quickly about a technology, and that's pretty exciting.
Yeah, I'll just add that I think, number one, you're seeing it across the board for sure. I had my teeth cleaned the other day and I saw a little sign and I asked my dentist, I said, what are you using for that? And I spent a half hour looking at their computer of how they're using it to interpret x-rays of your teeth and what it's showing. So those are applications where that, again, is more indicative. Now, where you get into the assistance, I think you're still gonna get stuck on the liability piece because we've seen that where we've been asked to deploy different areas for active monitoring and suggestion based on things like vital sign changing during surgery. So on the animal side, we do that, but FDA requirements are very different from humans, so we will make different claims for animals versus humans. But I think that's back to one of the main problems I think the industry will have to resolve is where does the liability rely? Because the second a doctor uses a tool that has an AI element to it to make a decision or to perform an action, is it the doctor's fault if something happens, you cut an artery in the patient codes? I mean, those are, I think, the areas where you're gonna have to figure out more broadly what that industry answer is. Because I don't think we've crossed that bridge quite yet into how that gets interpreted.
We are approaching it
Yeah.
quickly. Any other questions? Yes?
You guys mentioned like regulation, making sure that it's an like an ethical process, and then that's gonna involve like auditing, making sure like someone has to go and make sure everything is up to like regulation standards. How can, because we're all, a lot of us are students and are interested in AI, what are some like the opportunities and how can we position ourselves to take those positions in like compliance, governance, like overseeing these things? Because I think that's like new opportunities are opening.
This might be more your area, but I'll give you my 2 cents. I think you keep hearing me say Excel. I think that's the thing is, you know, years ago, everyone heard learning computer science and programming was the avenue for like you could write your check, right? That's changed now. And I think that's where kind of what you're describing is understanding the best way to leverage the AIs and how to actually create meaningful data. Because there's a lot of companies out there trying to do the same things, and there's only a few in all these verticals that are actually doing it well. You know, OpenAI everyone knows about, but if you actually look at what goes into creating these models and actually deploying it in a meaningful way, it's not as obvious, right? So I think that's the thing from like a student perspective is understanding how to leverage the tools and knowing all the chains in it, how it is a sequential thing, right? Because if you trip at the beginning, your output's gonna suffer. I think that's the way we look at it, and our company actually we work with a lot of graduate and PhD students in AI and engineering. And that's part of what we focus on with the research is applying it in those ways to look at how are you actually able to manipulate physical inputs, for example, so you get better data, or how do you manipulate, the software component. And I think finding kind of a niche within those elements is really where the next phase of the job creation will really be. I hear a lot of discussion on physics is a huge opportunity because the analytical rigor to be applied to this field. Well, 10 years, 15 years ago, you used to hear that say, go work at a hedge fund if you're a physicist. So I think it's all about learning how to leverage and use the tool the best, but actually at a core understand the limitations and how to kind of even exploit some of those is where the meaningful application will happen, and where people like yourself could have an advantage over another in terms of how to apply it and manipulate it, for X purpose.
Maybe I'll just add a little bit, and maybe not answering exactly your question, with respect to compliance and everything. There should be parts of the org that are really thinking about this, and they need to be in place, you need to work with them. But more broadly, I'd say for folks thinking about the workforce of the future, I think that you can, it's like one of those fundamental things moving forward. I think all of us use AI now, right, in some way or form. It's just a part of life. I use it every day at work. In my company, we have an internal platform that we use that's got all our protected information and yada yada, so that we can use it in appropriate ways, and it's getting better every day, and I'm just stunned by what it can do to help enable me in my job, let alone how I go and serve my clients. And so I would say the opportunity to make sure that you are using it, staying current, constantly learning. Like in my industry also, going to conferences, seeing what those new innovations are out there. I think when people go into companies, one of the nice things about being a consultant is you see so many different things. But even for myself, I need to understand the new companies out there. What are the innovations happening? And I encourage, all my clients to do the same, right? Get out there, you have to see what's happening, kind of get exposure, because things are changing at a pace that I've never seen before. And so, staying on top of it and how can you be at the leading edge of that, I think is going to be critical. And it's not a one and done, it's an ongoing period of learning for all of us.
Cutting edge people, McKinsey and Ponto Sensing, cutting edge entities, right? Let's give them a round of applause. Thank you so much for being here. We are a minute or two late. I apologize for that, but I hope you have a wonderful evening, and I hope that you gained something from your time here tonight.